Imagine your body's serotonin levels like a dimmer switch that controls mood, cognition, and various other processes. But what happens when someone cranks that dimmer switch all the way up? Today, we're diving into serotonin syndrome, a condition where too much serotonin floods the system, leading to a dangerous overdrive in the body. Serotonin syndrome is a potentially life-threatening condition that occurs when there's an excessive presence of serotonin, or 5-hydroxytryptamine, in the brain. This overactivity overstimulates central serotonin receptors, leading to a range of clinical manifestations affecting mental status, neuromuscular activity, and the autonomic nervous system. Typically, this syndrome is triggered by the therapeutic use or overdose of a single serotonergic drug, or when two or more drugs interact, causing an increase in serotonin levels. Now, let's break down what exactly causes this spike in serotonin. Firstly, we have an increase in serotonin synthesis, which can be triggered by drugs like phentermine and L-tryptophan. Then there's an uptick in serotonin release, commonly caused by amphetamines, dopamine agonists, or certain antidepressants. Lastly, the activation of serotonin receptors can happen with medications like buspirone, triptans, and even prokinetic agents like metoclopramide. Some drugs can reduce serotonin reuptake, including SNRIs, tricyclic antidepressants, and even certain opiates like tramadol. Others inhibit serotonin metabolism, such as MAOIs and triptans, while some drugs can impact the activity of CYP450 enzymes, like dextromethorphan. When multiple factors come into play, the risk of serotonin syndrome increases dramatically. Certain situations can make someone more prone to developing serotonin syndrome. These include taking two or more serotonergic drugs simultaneously, using serotonergic drugs along with CYP450 inhibitors, or even switching from one serotonergic medication to another without tapering off. Individuals who accidentally or intentionally overdose are also at higher risk. The symptoms of serotonin syndrome often appear rapidly, within 24 hours of taking the causative drug. They usually progress through three primary domains: neuromuscular excitation, autonomic nervous system hyperactivity, and altered mental status. First, there's neuromuscular excitation. Think of this as your muscles acting like they're in a constant workout mode. You might experience hyperreflexia, tremors, muscle rigidity, and even clonus, which are those involuntary rhythmic muscle contractions. It can also cause hyperthermia due to muscle overactivity, which can be life-threatening. Next, the autonomic nervous system kicks into overdrive, leading to symptoms like hypertension, tachycardia, excessive sweating, dilated pupils, and even diarrhea or vomiting. Imagine your body being in a constant state of adrenaline rush, even when there's no danger in sight. Lastly, there's altered mental status, which can range from anxiety and agitation to confusion, and in severe cases, coma. This change can be frightening for both the individual experiencing it and those around them. An easy way to remember the classic signs of serotonin syndrome is the mnemonic HAHA, hyperthermia, autonomic dysfunction, RIA, hyperreflexia, and altered mental status. And when in doubt, remember that serotonin syndrome is the one that shakes your extremities with myoclonus and hyperreflexia, particularly in the lower limbs. Serotonin syndrome is primarily a clinical diagnosis, meaning healthcare providers rely on the patient's symptoms and history of medication use. The Hunter serotonin toxicity criteria is a widely used diagnostic tool, where a history of taking a serotonergic agent combined with certain clinical features like clonus, hyperreflexia, or tremors indicates serotonin toxicity. In addition to clinical evaluation, lab tests might be ordered to check for complications like muscle rigidity or hyperthermia. Typical findings can include an increased white blood cell count, elevated creatine phosphokinase levels, and decreased serum bicarbonate. If not treated promptly, serotonin syndrome can lead to severe complications. These include ventricular dysrhythmias, rhabdomyolysis, where muscle tissue breaks down and can cause kidney damage, metabolic acidosis, and acute respiratory distress syndrome. The first step in managing serotonin syndrome is to discontinue all serotonergic drugs immediately. Supportive care is crucial. This may involve providing oxygen therapy, IV fluids, and active cooling measures to manage hyperthermia. For agitation or excessive muscle activity, benzodiazepines can be administered to help relax the body. In moderate to severe cases, a medication called cyproheptadine, which is a 5-HT2A receptor antagonist, can be used to counteract the effects of serotonin. This is essentially the antidote that helps bring serotonin levels back to a safer range. To sum it all up, serotonin syndrome occurs when there's too much serotonin in the body, often due to drug interactions or overdoses. It's characterized by neuromuscular excitement, autonomic hyperactivity, and altered mental status. Remember HAHA to recall the key symptoms. Early detection and immediate discontinuation of the causative drug are essential, along with supportive care and treatment to manage symptoms. And there you have it, the crucial facts about serotonin syndrome. If you enjoyed this in-depth explanation, be sure to check out King of the Curve for more educational content. Don't forget to like, subscribe, and hit that notification bell to stay up to date with all things medical.